Hi, I'm Dr. Paul, and welcome to the best of Baggers Blogs. This week, we're going to be looking at...
Hi. Skin. What is it? It is the largest organ in your body. Yes, it is an organ. It protects you. It stops all your bits falling out. It protects you against water loss, against damage from the elements. It's a thermoregulation. It controls your temperature. It helps you stay warm and helps you stay cool. It absorbs oxygen, nitrogen, and other elements that can diffuse into the epidermis. It is obviously water resistant. When you jump into a bath, you don't soak up water like a sponge. And it has endocrine function as well. It's the main thing that when we get sunshine, vitamin D is produced through exposure to the sunshine to the skin. UVA, UVB and UVC damage this very important organ that we've all got. UVA, think of it as UV aging. That's the one that ages your skin. It goes deeper into the skin. There's epidermis level, basement membrane, then dermis. And in the dermis is this collagen, these reinforcing bars in concrete that support the skin. UVA damages those. UVB, or think of UV burning. That's the one that burns your skin, you get a suntan, and it's the one that causes skin cancer. UVC is absorbed in the higher areas of the ozone layer, so it doesn't tend to come down onto the planet as long as we've got an ozone. Whatever the UV is, it damages your skin. You should be wearing at least a factor 15 to 25 every day. I get up every day, have a wash, put on a sunblock, just a factor 15, and that's why I'm pink. If you are pink, you are meant to be pink. If you are brown, you are meant to be brown. If you are black, you are meant to be black. White people trying to go black is a bad thing to do. We are white, we are not meant to be black, we are not meant to be brown, we are meant to be pink. This is the colour of the skin you were genetically born to have. It is not meant to be darker than that. Stop trying to get a tan. It doesn't work, it damages your skin, and really, to be honest, you look a bit stupid these days with a tan that makes you look like you've been tangoed. Please look after your skin. It's the only skin you're going to get. I'm going to put some pictures on here that will show you the damage that can be caused. One is from smoking. Twin images. This is one twin that didn't smoke, one twin that did. See if you can tell the difference. I bet you can. The next one is a young girl who was on sunbeds and got a skin cancer on her nose. That's the thing. When you tan in places where it can be seen. So you're going to get skin cancer where it's going to be seen. So this girl lost half her nose from skin cancer. That's really attractive, isn't it? Not. And then, finally, there's a UV image of somebody that's been on sunbeds to see the damage that it causes. The tear trough. What is it? What can we do about it? And what are the complications of dealing with the tear trough? What is the tear trough? Well, the tear trough is this little thing here, this dark line that you can see going from the corner of my eye down here. So the tears run down here, that's why it's called the tear trough. It is aging, it is fat that is in a position where it started to bulge out. It is laxity of the ligaments around the orbital rim. If you feel just down here under the eye, you feel that bone there. So that's the orbital rim. It goes all the way around, circle, because your eyeball sits in there. So the arcus marginalis, or the suspensory ligament of the orbicularis oculi, is here. And that gradually slips down. And what happens is the orbicularis oculi goes forward. It's not a descent problem as such. It is a repositioning of the fat that's an issue, and you can kind of see that if I do that, it kind of just takes away the tear trough itself. So that's actually got rid of my tear trough by doing that. So it's pulling on the subcutaneous structures, the fat, the orbital septum, the arcus marginalis, which is attached to the bone. They have to free it up and pull it tighter, so it's like a sling up to the corner of the eye. What you don't want is filler in there. You don't want fat in there. You will see advertised practitioners saying, we will put injections in your tear trough. I have seen so many nightmares with injectors putting collagen, filler, Juvederm, whatever. So putting filler in there is the wrong thing to do on its own. Dealing with the tear trough is complex. It is a multi-attack mentality that you need with it. It's not just putting filler in there, it is repositioning the fat, it is tightening up the arcus marginalis, it is tightening up the orbicularis oculi, it's tightening up the suspensory ligament of the orbicularis oculi, and it is repositioning the subcutaneous tissues. It is a big procedure. Merely putting fat or filler in there will make it worse in many instances. So beware the practitioner who says they can get rid of your tear trough for you with an injection. They can't. They've got multiple techniques of injection superficially and deep. No. I don't do it because it doesn't work. I've been doing this for 40 years and I know what works and what doesn't work. So the tear trough has to be looked at in a multifaceted way, surgically, retightening everything up. Filler's not the answer.
I'm Dr. Paul. This has been the Best of Baggers Blogs. See you next time.